Hey guys, hello, how are you all doing? Welcome to Ugly Medicine YouTube channel. So today we are going to discuss about anti-diabetic drugs, one of the most high-yield topics of today's examinations across the globe. So talking about anti-diabetic drugs, we all know the basic. There are two kinds of diabetes, type 1 and type 2. For the type 1, we all know we can't give any other drugs except insulin. And for the insulin, we have rapid-acting insulin, we have short-acting insulin, we have intermediate-acting insulin and long-acting insulin. Whereas long-acting is always preferable compared to others because long-acting, in the name as it says, long-acting, so patient doesn't need to inject himself all the time. Whereas coming to rapid-acting insulin is in the case of emergencies. So for the insulin rapid-acting, there's a clue here I want to give is GAL is rapid, GAL, G-A-L. So remember it's such way. So G is glulysin and A for aspart and L for lispro. These are rapid-acting insulin. The rapid-acting insulin onset is from 15 to 30 minutes. Short-acting insulins. In the short-acting insulins, we have regular insulin, and the regular insulin is drug of choice for diabetic ketoacidosis. Is given in IV drops, so we can reduce the sugar level in diabetic ketoacidosis using regular insulin. Coming to intermediate acting insulin, we have semi-lente, and then for the long acting insulins, we have glargine. Glargine is very important as it's peakless insulin, and glargine can be given for 1 day. Once in a day is enough, whereas others we need to give 3-4 times a day. So we prefer long-acting insulin for such reason. The other examples of long-acting insulins can be degludec, glargine, and detamir. So coming to the drugs, there are no drugs for type 1 diabetes mellitus, whereas for type 2 diabetes mellitus, we have the most important medicine, which is Metformin, which is drug of choice for type 2 diabetes mellitus. So Metformin acts on receptors. It decreases insulin resistance and then increases glucose uptake. So that's why Metformin is preferred, because it reduces glycated hemoglobin levels by at least 1 to 2 points. So that's why Metformin has been drug of choice. For the side effects of Metformin, we have nausea, vomiting, and then lactic acidosis. Whereas coming to other group of drugs, we have GLP-1 inhibitors. We call them glutides. Glutides are proteins, so they can be digested, so we can't give them orally. So for the tides, we have the examples like liraglutide, semaglutide. So the side effects of these drugs can be weight loss, but it can be useful for us in such a way that if you have a patient with diabetes and obesity, the drug you can prefer for him can be liraglutide because it helps weight loss in a patient, right? So that's of GLP-1 inhibitors. We have other group of drugs which are gliptins, which are trending nowadays. So here the most two drugs which are frequently asked in Indian examinations are linagliptin and sitagliptin. For linagliptin, it can be given in a kidney failure patient, whereas for sitagliptin, it can be given in a liver failure patient. So gliptins are also another diabetic group of drugs which are very useful. Along with GLP-1 analogs, we also have other group of insulin secretagogues, which are sulfonylureas. So for the sulfonylureas, the examples of drugs can be for the sulfonylureas, we have group of drugs which are glipizide and glimepirides and glibenclamids. For the side effects of these drugs, it can be weight gain, can be seen in this group of drugs. So that's all for the drugs of diabetes in a shorter version, whereas if you want the longer version, you can check in the comments or ask me for more doubts if you have, or a PDF can be given in the a PDF of this session can be given in the description below, so you can get all your diabetic drugs in one place for the examinations. Have a good day, guys. Thank you.